of former U.S. Army Dr. Sudip Bose.
Dr. Sudip Bose. Dr. Sudip Bose.
You can read about Dr. Sudip Bose's story in today's edition of the Daily Herald. This guy treated Saddam Hussein.
New details on that deadly accident between a train and a parade float.
They jumped off that trailer. They were able to help tie tourniquets and stop bleeding vessels. I couldn't have done it without their help. They just began attacking us. We had to try to provide the care, but at the same time, having stones thrown at you, you're getting attacked by mobs. Courage isn't the absence of fear. It's just realizing there's something greater than that, going forward and doing your job. Split-second decisions are made. It's protocols that are made years in advance. So trauma care is very protocol. It's almost cookbook. I mean, you have to stay in order because it's very easy to see something extremely distracting. It's important to stay on the mission and stay focused in trauma care.
Sudip, remember that job at Little Italian Pizza? You were the doughboy, remember? What possibly could you learn from making pan pizza and thin crust?
The number of doctors are decreasing. There's going to be a shortage. But there's a solution. To improve healthcare in America, we need you guys, the politicians, the senators, the congressmen, and we need America to engage. There's a study out of the Harvard Business Review, and they asked, can wellness programs reduce out-of-control health costs? Healthcare reform affects all of us. We hear what's going on in Washington, D.C., but how does that affect you? How does that affect your organization?
The talk today by Dr. Bose was enlightening to me.
Dr. Bose was able to incorporate the war-like situations that he faced during deployment in Iraq, and he was able to apply that into a work-life setting here at headquarters at Discover Financial Services.
You know, if you look at this healthcare and all the pieces of the puzzle, there's everything here at Capitol Hill to all the legislation, to the Affordable Care Act, to all these pieces. But the center of the epicenter is the doctor-patient relationship.
Yeah. If you have an emergency, which we don't know when and if that can happen to any of us, whether we're elderly, whether we're young and healthy, you never know what can happen.
Right.
So if you pay this ahead of time, then if you have to call that ambulance, you don't get a bill.
So,
it saves you hundreds of dollars.
Right, it's a special kind of insurance, and then it also covers your entire family.
It does.
The staffing is a big part of it too. Across the entire country, there's a nursing shortage. If you look here across the emergency room, this is our nursing segment, and you see there's no nurses sitting here right now. And this is not a problem at one hospital. This is a problem nationwide. So, when you see that nurse, that nurse is probably working for several nurses and doing the job of several nurses and probably the job of several techs as well. So this is often frustrating for the patients, and I think it's important to see behind the scenes what is going on.
In January 2004, Dr. Sudip Bose, a captain in the U.S. Army, found himself on the front lines of a war zone in Iraq to serve with his fellow soldiers in Operation Iraqi Freedom.
The blades of a copter whipped hard. He was coming. The area was cleared. A few key personnel remained. 6 soldiers armed with M16 rifles. Aside an elderly man in a wheelchair, blindfolded and restrained. I'm Dr. Sudip Bose, and this next patient is quite possibly my most important test of decision-making under pressure.
I just cannot more highly recommend Sudip Bose. He's a fantastic speaker. Make sure you get in his audience and listen to his message.
I'm surprised on how many different areas that I work in my life and with my clients that I'm able to apply the things that he applies on the battlefield or in ER or with leadership techniques.
Because we're all one step away from an emergency. 300 million of us in the United States. And you don't want to end up in that emergency room. The overcrowded emergency room where ambulances are diverted and specialists cannot come in because insurance plans are narrowing the network. Insurance is a pooling of money. We need insurance. They do a great thing. They help us afford health care. However,
If insurance companies could change their strategy in this manner, millions of lives would be affected in a positive manner. And they would see an increased return on investments. They would have less payouts. This to me seems like a simple fix, but you need to be on the front lines to see it. You need to be treating patients to see it. And there's a disconnect between the policymakers and the people who treat patients. If we can narrow that disconnect and follow these strategies, we'll all benefit as a nation.